Hi, my name is Patrice Washington.
Anastasia Patterson.
Cajun Hayes.
I'm Brianna Montgomery,
Shanice McMullen.
and we're going to be talking about health disparities.
And HIV.
And Planned Parenthood.
Starting off with health disparities, it can be defined as inequalities that exist when members of certain populations, groups do not benefit from the same health status as the other groups.
On behalf of UCLA, it is my pleasure to welcome all of you to our 14th Annual Health Disparities Symposium. We started in 1999 as a way to involve the community in the work that we were doing. So there are many community organizations that help address health disparities and achieve health equity. And so what we do is work with those organizations in partnership to create programs, collect data that will together help address disparities.
When you have people on the ground that are doing the work, oftentimes they're not as connected to what's happening on a political level, right? And so having an event like this really allows people to get together, get educated, connect with other organizations, and build networks so that they can have a bigger impact on the issues that are facing our community.
When there are issues that are emerging, such as the Affordable Care Act, we bring experts together that can help shed some light on some of these issues.
I feel that it was really important for me to be able to speak to this audience today about the Affordable Care Act, because I feel very strongly that the ACA is going to provide a degree of equity to access to health insurance in the United States that we have not had for the last 50 years.
Now is the time to get everyone engaged. This conference is absolutely essential to get the word out to the communities that are most affected by the uninsured, because there's a great opportunity.
All right, everyone, time to get on your feet.
We are being here for almost 4 times. This is very important to us because it's a lot of information that we have to keep up to know in order to educate our community.
It's just a way to stay connected with the community and for the community to stay connected with us.
Well, we know so much about Planned Parenthood and HIV. What else we know about health disparities? Back to health disparities.
So with health disparities, some of the examples are exposure to environmental problems, the lack of education, the poor access to healthcare, and the poverty levels.
Some interesting facts about health disparities would be in 2008, approximately 33% or more than 100 million people identify themselves as belonging to a racial or ethnic minority group. Also, in 2008, 51% or 154 million people were women. Also, did you guys know that in 2002, an estimated 4% of the United States population ages 18 to 44 identify themselves as lesbian, gay, bisexual, or transgender?
I had no clue.
Not a clue at all.
That's crazy.
Well, I got 7 interesting facts about HIV and AIDS. Globally, 40 million people are infected with AIDS. Approximately 2.1 million of those are under the age of 15. Fact number 2, HIV is the world's leading infectious killer. To date, approximately 25 million people have died of AIDS around the world. Fact number 3, HIV has emerged from Africa and spread across the globe in less than 10 years. And another fact, global HIV affects women. For many years, China called AIDS the loving capitalism disease and claimed it was a disease caused by contact with the West. In 2009, China reported that AIDS had become the country's leading cause of death affecting disease. Also, another fact is more than 1 million people in the U.S. are currently living with HIV infection, Also, almost 1 in 5 of those living with HIV in the U.S. is unaware of their infection. Another fact is every 9.5 minutes, someone in the U.S. is being affected with HIV. Also, approximately 50 million Americans become affected with HIV every year.
9.5 minutes.
That
Ain't
is
no
crazy.
sex.
We definitely need to know. Oh, hey, Sierra.
Hey.
Oh, whoa. Sierra just came back from getting tested.
Girl, what the results say, girl? Let me see what the results say.
Negative. Everything A1.
Hey.
Know your status. You gotta know your status.
I'm trying to tell you. Well, y'all tell me when the last time y'all got tested?
It's been a little minute.
A minute. Well, dang, y'all know women attract HIV and AIDS easily than men, right?
Yeah, I mean, we also know HIV is the leading cause of death in the United States.
Especially for the African American community.
Y'all know how y'all contract it, right?
Yeah, there's all type of ways to contract it.
Unprotected sex, oral sex.
Anal sex.
Oh my God.
Oh my God. It's rectal fluid, semen, breast milk, blood.
It's so many other
Vaginal
ways.
fluids, needles.
It's blood transfusions, all that type of things.
What is HIV and AIDS?
Well, HIV stands for human immunodeficiency virus. It's the virus that causes HIV infection, and the abbreviation HIV can refer to virus or to HIV infection.
Do you guys think that boys or girls get it more?
I think guys, but apparently statistics says females, but
But I heard that gay guys get HIV more than females do.
right.
Because of the rectal fluids, because
Not using protection.
That's the number one.
Yeah, you're right. Not using protection.
That's the big one.
So
make
use
sure
protection.
Please do. Or you will die.
Okay. I got a question for y'all. What do Planned Parenthood provide? What services?
They have, you can get tested, mammograms. You can do breast cancer screenings, I believe. Birth control. You also could get condoms.
We have a couple of facts about Planned Parenthood. 3% of all Planned Parenthood health services are abortion services. And in 2013, abortions made up 94% of Planned Parenthood's pregnancy services.
Well, y'all tell me what y'all think about abortions.
I mean, I feel abortions should be,
Banned.
What?
Yes.
No, I mean, it's my body. If I want to abort a baby, I can.
Oh my God, you should not lay down.
So you mean if she get raped, she can have
I supposed to have my rapist baby?
Because a lot of people don't want to deal with that every day. They look at their child and they said, this person raped me. Like,
So then they put their hatred out on the child.
That's traumatizing for them too.
But what about the child?
I mean, you don't want to bring a child up and can't afford to take care of it.
Okay, so what's worse, having your rapist baby or taking your anger that can lead to abuse on your child?
Just put the baby up. Don't abort.
But not a lot of people like to put their child for
Adoption. Not everybody could carry a child for 9 months and then have to give it away after labor, like right after they cut the umbilical cord. No, we are right.
You should abort the baby.
You don't make it sound mandatory, but it's just an option.
You can easily go to Planned Parenthood. I mean, you can get a monogram, and you also can, get condoms there. Safe sex,
Birth control.
Yeah, they definitely give out birth control.
Female condoms too. I be forgetting about that.
Men's too now.
Well, of course.
More than 200 million women around the world want to plan or avoid pregnancy, but lack access to modern contraceptive methods. In poorer countries where family planning services are not readily available, young and rural women must often suffer harsh consequences. Young women who are unable to prevent pregnancy are forced to drop out of school. Many women have more children than they can afford. Unsafe abortion and maternal deaths increase, so more children grow up in households without mothers. All of these health consequences put a financial strain on families and make it harder for developing countries to promote healthy, peaceful, and prosperous societies. But when these countries have access to family planning, the picture completely changes. There are fewer unintended pregnancies, which mean fewer complicated pregnancies and unsafe abortions, and ultimately fewer pregnancy-related deaths. Women have more time and resources to care for the children they have, and women then are more likely to stay in school, pursue careers, and contribute to the local economy. And thriving local economies will eventually lead to political stability and healthier families. The U.S. is a leading source of support for many global health programs, including contraception, and has been for 40 years. But when U.S. funding is cut, women all over the world feel its impact with restricted access to contraceptives and the closing of clinics. Now this is where you come in. Congress decides how this money is allocated, but Congress also represents you. When you tell your representative in Congress that women's health is important to you, you empower your representative to support international family planning programs, which lead to fewer unplanned pregnancies, more women in schools and jobs, and ultimately healthier and stronger futures for all. Sign your name to Planned Parenthood's Health Has No Borders petition to show your support for robust investments in global health and the elimination of disparities everywhere. When it comes to health, there should be no borders.
Yo, what's up, y'all? How y'all doing?